I'm Mike Breen, Public Ordinance Officer for the American Mathematical Society, and I'm talking with Mac Hyman at Tulane University. And Mac has been keeping us up to date on what's going on with COVID-19 and the models, mathematical models associated with the epidemic. And so today we're going to continue that, and Mac is going to tell us, we'll start out talking about the reproductive number. And so, Mac, can you tell us about R0?
Okay. Well, R0 is the basic reproductive number. And I'm going to start by talking about the reproductive number, which is if you take an infectious person and introduce them into a population, on average, how many new infections does that infectious person cause? And R0, or the basic reproductive number, is the reproductive number at t equals 0, so R0. When that first infectious person enters a population of completely susceptible people, and no one is changing their behavior, how many people are going to be infected? And so in the very early stages of the COVID-19 pandemic, this was the important quantity. But it changes over time. The reproductive number evolves as the epidemic evolves. So let's say R0 was 5 and the reproductive number was fixed at 5. Then each of those 5, the initial infected person would infect 5 people. Each of those would infect 5 to 25. Each of those would infect 5 to 125. And the epidemic grows exponentially. And however, this isn't the way it happens because people do change their behavior. And the other thing to recognize about the reproductive number is that it's an average quantity over the whole population. Not every infectious person will infect the same number of susceptible people. And so when we're modeling it, we have to take into account this distribution. Now, why it's important and why R0 is so important is that it gives us a guide for how people change their behavior. And by guide, for example, the current COVID-19, there have been estimates of R0 ranging from 2 to 3 up to the teens, with an average probably around 5 or 6 was the more recent paper that came out from Los Alamos. And what this means is that if R0 was 6, reproductive number was 6 at the beginning of an epidemic, we have to change our behavior by a factor of at least a factor of 6 to bring it under control once we start unlocking the lockdown, okay? Now, the reproductive number is different for different types of diseases, calculated differently. So if a disease is transmitted mostly by personal contacts, then it can be broken into 4 factors. And it's the product of these 4 factors that matters. The first is the transmissibility factor. Transmissibility means that how likely is it that if an infectious person has contact with a susceptible person, the susceptible person becomes infected. Okay? And this depends upon how infectious the person is, which might be based on hygiene habits, how much virus they're shedding, whether they're wearing a face mask, as well as how susceptible the person is to infection. So someone who can be infected, are they wearing a face mask and hand gloves? So we have to estimate this factor. The next term is the number of, and also you can see if the infectiousness goes down by a factor of 2, then that infected person will infect half as many people. Now, the next term is the number of contacts. If we double the number of contacts an infectious person has, the number of infected people doubles. So we need to, so when we talk about reducing R0, we need to talk about how much they have to reduce the number of contacts. So if the only factor we could change was number of contacts, we'd have to reduce our number of contacts by a factor of 6 or more when we unlock the lockdown. The next factor has to do with the length of time that a person is infectious. Not the length of time that they're infected. Doesn't matter. It's how long they're infectious and circulating in the population. So an infectious person that's walking around the population, if they continue to walk around twice as long, or infectious twice as long, they infect twice as many people. So one way we can drive down the reproductive number is to get the infectious people at home or isolated as soon as possible. So if we catch them early, then we reduce this factor. And that's why the testing needs to be so much more prevalent than it is today, because a lot of this epidemic seems to be spreading through asymptomatic cases. And if we can let those asymptomatic people know that they're infectious, and we reduce the time that they're out there by a factor of a half, that means we just cut the reproductive number in half. Now, the fourth factor in the reproductive number is not in the basic reproductive number. That's the probability that the contact that an infectious person has is with a susceptible person. Now, for the basic reproductive number, we assume everyone is susceptible. So that probability that the contact is with the susceptible person is equal to 1. But as the epidemic grows, this changes, or as we have vaccines. Vaccines are a good example. So measles and pertussis have an R0 of about 15, which means on average, one person with the measles will infect 15 other people. To bring measles under control, one way to do it is to reduce the probability that a contact is with a susceptible person. We can do the vaccination. So that means we have to vaccinate the population so that only 1/15 of the population is susceptible. So that's the reason we look for 94% vaccination coverage for measles and pertussis and these type of diseases that have very high R0s. So this last factor is really important. Once we have a vaccine, it's not that important when the epidemic first starts, but it quickly becomes important because the probability that your contact will be with an infected person will have with a susceptible person depends on how the population mixes. And once people become infected, they're far more likely to have contact with their family members than people that are across town they may never have met. So our random mixing models that assume that everyone is equally likely to have contact with an infectious person, that the contact is with a susceptible person. Because when they get infected, often they stay at home, their family members becomes infected. And so now their contacts are not with susceptible people, but they're with other infected people, or recovered people. Okay. So it's these four factors that go in. And to keep this epidemic under control after we unlock the lockdown, we have to drive the product of those four factors below the current reproductive number, or below, in this case, say it's 6 or 10. That means we have to reduce the reproductive number by a factor of 10. Now, luckily, we don't have to do it with any one of these factors. And the only way we'll possibly do it by hitting all four. Okay. Now, this is the reproductive number for an epidemic or disease infection that transmits just person-to-person contact. Influenza, this is a pretty good approximation. Smallpox, the flu. COVID-19, it may not be that good of an approximation because fomites are any object where the virus can live, the infection can live and infect others. Whereas for the flu and influenza, a free virus may only live a few hours. It appears that the COVID-19 virus may be able to live for a couple of days. And so the reproductive number has to take into account the role of fomites. And they play a vector like when we model malaria or dengue fever, where mosquitoes play as vectors to transmit the disease. These fomites are vectors in transmitting this disease. So if an infectious person infects, say, a dollar bill, and that dollar bill circulates in the population for the next 2 or 3 days, our models need to estimate how many people will become infected by that dollar bill. If they use a stair hand railing or doorknob, our models need to come in and approximate this. And so R0 also has these factors to take into account. And so social distance alone is not enough. We also have to go after the fomites.
Now, I'm sorry, Matt, go ahead.
Oh, no, sorry. So one question I often get asked is, how do we estimate R0? Or the reproductive number? And there are dozens of papers that have been published in the last month on estimates for the reproductive number. And it's an elusive thing. It's not as easy as you might think, because what we really need to estimate the reproductive number is the number of people that are infected in a time series, say number of infections per week or per day. And we need to know an estimate for how long someone stays infectious. We can't separate the two. The only thing we really estimate, if we have the true number of new people infected, is the product of R naught times the length of time someone is infectious. We can estimate the R naught per day in the early epidemic, but not the R naught per person. So the first thing we have to estimate is how long we expect that infectious person to stay circulating. Now, we don't have how many people are infected per day. What we have is how many people are tested per day, or how many people are seriously ill, or how many people die. So if we take the number of people that are tested, we know this is a serious undercount, but it's all the information we have. So we have to first make an estimate for, if we have so many people confirmed positive, how many people would have been confirmed positive if we had tested the whole population? That's an estimate that has to go into the calculation. Once we get that estimate, we have to estimate how long these people have been infected on average. We have to back calculate, they've been infected 1 week or 2 weeks. Once we roll that all into the equations, we then can do a least squares fit to fit an exponential through the infection. And from that, we can get an estimate for R naught in the early epidemic. But with that estimate, we have to have all the caveats of what our approximations come from. And that's the reason the current estimates are all over the map. Some are quite small, 2 to 3, some are 5 to 6, some are as high as 10. But what it really says as an average, it's much higher than the common cold or the flu virus, which means that we have to take far more drastic measures when we unlock the lockdown. Mike, does this kind of explain it a little better?
Well, that's a lot, yeah. And so one thing that came to my mind is, it might be obvious, but because this is so new, nobody, you might say, really knows what's going on. That's kind of an oversimplification. But
that's a very oversimplification, because I think that would have been true 20 years ago. Mm-hmm. The models at that time were far too simplistic to be able to understand this type of dynamics at this level. There are several current models, in particular, several of the ones by, I think I mentioned last time about NIH, NIGMS, the MIDAS project, Models for Infectious Disease Agent Study, as well as Department of Energy. Los Alamos in particular has a code which includes the movement of individual people, the role of fomites. When people go into a room, the room becomes infected. Behavior change. And so modern models have all these factors in there. And they're able to ask what if questions, like what if half the population stays home and doesn't go to work? How would this impact the spread of the epidemic? And I do want to mention that the Los Alamos model just went online last week. And so people can look at it county by county to see what the projections are. And I'll send you the link so you can run it across the bottom of the screen if people want to check it out.
And so then are the estimates all over the place? It's not because of...
No. The estimates for the long-term behavior, where we'll be next fall, all depend upon personal behavior. How we as a population respond when we unlock the lockdown. And predicting individual behavior is a lot harder than predicting the weather. And so models, so when you look at a hurricane map, you see the spaghetti map. Those spaghetti maps are pretty tight compared to the long-term forecasts of these models. What we really need to do, if we had a commitment that people truly would change their behavior to reduce the reproductive number down by a factor of 10, they would all collapse. And with these leveling off that we're seeing now in the infections would continue. But that's the level of change that we have to have. It's a factor of 10 that we have to change our behavior. And right now, I think the realization that it's going to be that drastic of a change is just starting to hit the public.
And so when you talk about a factor of 10, and you mentioned a factor of 6 earlier, you're aiming for...
6 would be the minimum. I mean,
right. But you're aiming for, the goal is an R equals 1?
No, no, the goal is far, far less than 1.
Oh.
Maybe not far less, but remember R is an average.
Mhm.
And it's not only an average, what makes it hard, it's not the distribution for the reproductive number is not a nice Gaussian distribution. It's highly skewed with a long tail, a long fat tail at the high end. And so the people that don't take this seriously, they're the ones that will be driving this epidemic, which means that we have to reduce the average reproductive number far less than 1. And so if it truly is a mean of 6, that's a skewed distribution, the median might be as well be 10 or more. And so it's a massive amount of change that we have to do when we start unlocking the lockdown. Still wear the mask, still wear the gloves when you go to the supermarket. One of the biggest ones is testing, reducing that time that infectious person is walking around to make it a very simple, quick and easy test. And later antibody tests so that people that have been infected in the past know they don't have to take these precautions. And that will greatly lessen up at least the threat.
And now you mentioned fomites, in our last interview, and then in this one too. When you were talking about like dengue fever or malaria, I thought of malaria because it was mosquitoes. Yeah. Is it, you would think trying to beat mosquitoes is much harder than trying to beat hand railings, but maybe that's not the case.
I think beating hand railings is a whole lot easier than beating mosquitoes.
Oh, okay, good.
Because and one way to do it is not to expect the janitorial service to do it for us. It's a matter of us all taking personal responsibility. And if you only have one person in your building cleaning the handrails, yeah, it's going to be hard. But if a half a dozen people to say, I'll be happy to walk in every morning with my spray bottle, things can be brought under control. And you realize this is not going on forever. If we are lucky, we'll have a vaccine in a year. We may not be lucky because it's an RNA virus, and RNA viruses can be notoriously hard to develop vaccines for. HIV is an example of an RNA virus. After 40 years, we still don't have a vaccine. So we're hopeful for this one, but it's by there's no guarantee. So.
And so you mentioned, wiping hand railings. Well, that's something everyone can do, including mathematicians. Is there anything or things that you think mathematicians could do now or should be doing now?
I think what mathematicians can do is talk about the qualitative aspects of the models and how they work. I'm really encouraged that we have such a huge response among the mathematical community for looking any way possible to try to help improve the mitigation of this epidemic. I've never seen such a response. I mean, we had a large response with Ebola, but that is small compared to what we're seeing now with the current epidemic. And so for mathematicians to get out words, well, like the reproductive number, breaking it into these 4 factors and showing how each factor can be addressed independently of the others to help bring the epidemic under control. So for us, it's a very simple formula, 4 terms. But for the public, it gives them a framework to think about what they might do to drive the control to help with the control mechanisms.
So Mac, once again, you brought us a lot of information. We appreciate you taking the time, going to your office to do it. And is there any one big thing you'd like people to know?
Oh, I guess there are two things. First is the simple description of the reproductive number is something our mathematical community can relate to the general public to kind of give them a way to understand what is going to be needed to bring the epidemic under control. Although it's 4 simple factors, it's a framework to describe what an individual can do to protect themselves as well as to protect others. And the other thing I want to pass on to the community is reiterate what I said last week, is that we have to be very careful about using simplistic models for guidance for public health officials, for overstating their ability to predict. And earlier I mentioned predicting the weather. And one of the classic equations in applied mathematics are the Lorentz equations. 3 ODEs that were derived from the weather equations, which exhibit chaos. Although they were derived from the weather equations, we would never dream of using the Lorentz equation to predict next week's weather. In the same way, we shouldn't dream of using a simple 3-equation SIR model to predict where this epidemic will be next week. And so that's kind of when I want to leave, Mike. And it's been a pleasure talking with you again.
Well, thanks. And then SIR is susceptible, infected, recovered?
Right. SIR, susceptible, infectious, recovered. It's the simplest 3 ODE model for an epidemic. And a true epidemic model is even more complicated than the weather equations. And we need to keep that in mind when we start using our models to do predictions.
All right. Well, Mac, I want to thank you. I stepped on your thank you. Sorry.
Well, thank you for thanking me.
And once again, thanks for all that information. That's Mac Hyman from Tulane University. Tell us what's going on with COVID-19 and the models. Thanks, Mac.
Okay. Thank you, Mike.